Welcome to another exciting episode of In-Depth Eye Health podcast series brought to you by iFocus and iHub Nigeria Initiative. The series provide incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen. Okay. Our guest for today is Dr. Mahmoud Baranini Alhassan. He's a consultant ophthalmologist and a vitreoretinal specialist. He's also the Chief Medical Director of National Eye Center, Kaduna. Thank you, Dr. Mahmoud, for joining us today.
Thank you so much. It's nice to be here. It's a privilege to speak in this podcast. Thank you.
Thank you, sir, for coming.
Yes.
This is year 2020. The Right to Sight is a global initiative for the elimination of avoidable blindness, a joint program of the World Health Organization and the International Agency for the Prevention of Blindness. How is Nigeria playing out?
Well, thank you very much. This is a broad question. Well, Nigeria as a country, I think we have made a lot of impact implementing the Vision 2020. Number one, there have been increased advocacy. The issue of visual impairment and blindness have been brought to front importance in healthcare delivery in Nigeria. We have achieved integration of eye care into general health system, which has been the biggest challenge. We are used to running standalone eye care programs, but with the implementation of Vision 2020, we have been able to at least achieve some elements of integration of eye health programs into the general health system. Secondly, the specific disease control programs have also made a lot of impact, especially cataract, trachoma, and onchocerciasis. It's a journey in progress. I know onco has been greatly reduced. Trachoma, we have joined the ITF and other programs in dealing with acute inflammatory conjunctivitis from trachomatis, and also dealing with trichiasis and its associated problems. By way of human resource development, and that is still ongoing. It's a big challenge. Nigeria is a huge country. The ratio of ophthalmologists to the population is still far below what is expected. But
Yes,
there are a lot of progress is going on. We're training people. People are being encouraged to link out and go to the rural areas and help deal with eye care programs. Secondly, the allied eye health workers also a lot of efforts training them, the ophthalmic nurses, technicians, refractionists, and others. And I think we have not reached where we want, but I think we are on the way. And with concerted efforts, I think we should get to the world benchmark of acceptable level of visual impairment and blindness.
yes, Nigeria has really come a long way.
Yeah.
So, Vision 2020, The Right to Sight, was launched in 1999, and it's sought to promote a world in which nobody is needlessly visually impaired, and where those who have an unavoidable vision loss can achieve their full potential. So what efforts are being made from both government and non-government perspectives to achieve this?
Yes, thank you very much. From the government side, I think, as I said earlier, I think the government is now well convinced that eye health needs to be integrated and need to be considered as a very, very important component of healthcare delivery. The government is keen into universal health coverage, and eye health is also a prominent component of that. The non-governmental perspective has been also aligned to realizing universal health coverage, i.e., they are also moving away from standalone programs, especially disease-specific programs, which were the non-governmental agencies are known for, and also now linking out to integrating eye care and associated problems, manpower development, specific disease control, but as an integrated component of the general health system. And I think the non-governmental side are also thinking about resources, materials for delivery of eye care, i.e. procurement of various components, the surgical materials, drugs, and other issues, other materials that are needed to deliver eye care. So the efforts are being integrated together, both the government and then the non-governmental. And then the government has also come to realize that it's better driven by government efforts than by non-governmental um, effort. We know we cannot do away with them, but it's better we nationally determine what we want, and then the non-governmental people should organizations should key into what the government think is important for us to
Okay.
realize our goal of eliminating avoidable visual impairment and blindness in Nigeria.
Yeah.
Thank you. Yeah.
So let's discuss the core strategies: the disease control, human resource development, infrastructure, and appropriate technology development. Training of specialists in eye care is very important, and it may be a very key factor for universal access. What are the challenges so far?
Well, I think the biggest challenge is for training is there are twin problem of resources, training materials, and then the trainers. Nigeria, as I said earlier, is a huge country. We need to upgrade and acquire new infrastructure that will facilitate training of more eye health care workers across all these all cadres of eye care workers. Training, especially ophthalmology, is an expensive business, and it takes time. I know the colleges that certify this training have taken looking at how to facilitate and improve the training so that the products will be very good. Also reduce the training time. Um, the other challenge is, as I said, is financing. Training ophthalmologists is very expensive, and I think the government and all the general stakeholders need to be convinced to invest in training eye health workers, especially ophthalmologists. So this issue of the trainers cadre is another challenge, and the biggest challenge actually that we need to train the young ophthalmologists for the future, thinking about the developments in eye health delivery, and I think that has to be looked at seriously. Very soon, people will come to your OPD and tell you, I want a laser cataract surgery, and you cannot do that. I think you have lost that opportunity. So the issue about the trainers that need to be retrained, and then also to acquire skills to train the young ophthalmologists for the future, and then the resources to achieve this. And as I say, it's a huge task, and I'm sure we will, together with the government, I think we should increase our advocacy for training. This specific disease control, I think we're making a lot of progress, especially with cataract, which is the major cause, and trachoma. Surgical intervention for glaucoma is far-fetched, but I think we need to think together and really, really empower ourselves to deliver the most appropriate intervention for glaucoma in Africa, which is surgery. Thank you.
Okay, thank you very much. So, the aim, the aspirations, the principles and approaches that were at the heart of the original Vision 2020 initiative, they are still very relevant to this day. So how does the recent World Report on Vision complement the Vision 2020 objectives in addressing the challenges of inequity in coverage and quality of prevention, treatment, and rehabilitation services?
Yes, the World Vision Report has just come to update and then to bring up to fore the journey so far and what needs to be done. The numbers are scary, but I think it's important for us to be reminded about what is ahead of us. So the World Vision 2020 has further reinforced and bring to forth the challenges that were brought forth by Vision 2020, and I think is also a good avenue for allowing us to also determine the way forward. As I said earlier, the numbers are big, but I think we should not be discouraged. So there's more work needs to be done in terms of advocacy, trainings, seal specific disease control, and then also to understand that we're having new challenges. The population is aging, so we also have, even in Africa, we have to now think about getting ready to deal with non-communicable diseases that affect vision. And I think the World Vision report is timely, and I think, as I said, is it's important that it will put us to be alert and also prepare to face the future challenges, and also to further achieve the aims of avoidable blindness.
Yeah. Thank you so much for joining us on this maiden episode of In-Depth Podcast, jointly organized by the iFocus and iHope Nigeria.
Yes. Thank you so much. It's my pleasure, and hope to speak to you soon.
Yeah.
Thank you so much.
Yeah.
Thank you.
According to the World Health Organization, at present at least 2.2 billion people around the world have a vision impairment, of whom at least 1 billion have a vision impairment that could have been prevented or is yet to be addressed. The world faces considerable challenges in terms of eye care, including inequalities in the coverage and quality of prevention, treatment and rehabilitation services, a shortage of trained eye care service providers, and poor integration of eye care services into the health systems, among others. The World Report on Vision aims to address these challenges and galvanize a global action. Thank you for joining us on this episode.